That's one of my greatest challenges is well-meaning patients with their exposure to naturopaths and other integrative physicians and Google, because they all
Dr.
most
Google.
most patients are very self-advocacy based, and they do amazing research, and they come in with a constellation of or a list of or often just, I've got Lyme or mold, but then they've got a
Yes.
few other things. And then you've got to try and negotiate your way through that particular approach to try and flesh out the complexity that you can find when you do a long history and do many lab tests. I have a terrible reputation of doing too many lab tests, but I can tell you, I can't practice with doing a food sensitivity or a stool test showing you got gut permeability or a hormone saying your adrenal. That those days are gone. I can't practice like that. I refuse to, and I make no apologies for doing extensive testing, trying to look at the domain that is most helpful to get a patient turned around and back into the healing cycle. You know,
Yeah.
you need lots of labs. You can't just do a few things and think you've got it covered. You can't do that. I might
And you
that's my
need some
opinion.
no, and you need someone that truly can read those labs too and understand them in their comprehensive nature. I just had a person I know reach out to me and say, "Hey, I just got a lab back that shows lipoproteins are very high. What does it mean? Ask your father, ask everybody." And I go, I don't think that's really the full picture, but but her doctor wanted her to act on that one thing they found and do it. So again,
So
we
you
we
see that a
like to
lot.
reductionize everything to its minimal. This is your problem,
You
but
see that
you
a
know
lot.
this. It's not.
One of the things I don't do is give out lab tests to patients before I see them, because what
Smart.
they usually go and study on Google, and then the entire interview is well, it's not that I don't do it, but the entire interview then becomes me trying to calm them down that that slightly raised
Yes.
level is not your problem. You got to look at the trends, the sort of biochemical movement of what's going on to try and work out a hierarchy of their diagnostic and therapeutic needs. And
Yeah.
it's not one insulated biomarker, you know.
No, it's an artistic approach to
Uh,
assess things, but it's also the artistic approach of treatment and what kind of tools you have. And with something that is complex and that is
and what kind
often
of human being is in front of you, because
that too.
they have different defenses, they have different typologies, they have different Myers-Briggs, they have different attachment styles, they have different early childhood trauma. One of the more difficult or most difficult people to work with are those who have early trauma, who have
Mm,
never established a sense of limbic resonance and trust and ventral vagal security with anybody. And so they always, well, not always, but most often, are highly sensitized to not being seen and heard. And if you so much as mention something that's out of their belief systems, they can become very defensive, lose trust in you, and then you become merely another force that they project their early childhood wounds onto, and they don't trust you because you
yes.
interfere with their belief systems that they learned on Google. So it is the art of medicine. You have to know who's sitting, and you have to do your best. It's not a perfect art or science. It's an
No.
ongoing strategy, and sometimes you never can establish trust with somebody who's deeply wounded. Their defenses are they have so much rigidity and so much riding on protecting the last vestige of innocence that's beneath all that trauma, that they won't allow any other belief to sort of get between them and their sort of that part they're protecting. So sometimes you fail. I mean, you do your best, but
Yes.
sometimes you fail. And then you got to
Yeah.
bear the brunt of the projection.
No, and oftentimes that failure isn't because you didn't have the solutions or knowledge. It's because the patient or the person in front of you wouldn't allow that. Sometimes people are stuck within their diagnoses. Sometimes they are stuck in victimhood mentality. Is that not part of it? Of course, you try and break them out of it. That's the best, but there's only so much a doctor or any person trying to help can do.
Absolutely. And one tries not to be reactive to the projection. You try and work with it, but sometimes it's very difficult sometimes. You can't break through that. And no matter how you try and establish empathic understanding, insight, override it with salience and knowledge, or say, that insight you have, I understand why it's there, but you may need to reframe it in this possible way and work with a somatic experiencing practitioner to try and downregulate your amygdala hyperactivity and fear of that particular thing. And you fail sometimes, and it's one of the great, one doesn't know how to negotiate through all of this. But thankfully, most of the time we are able to enter into a person's psyche with enough sensitivity most of the time to not trigger that defense that just says, I don't trust you either, like I didn't trust my mother or my father. And I
Right.
don't trust 100 other doctors I've seen who said the same thing,
Right. Well,
You
that's
get
the
20
thing.
right.
Oftentimes, by the time they end up with and the openness to see someone such as yourself or someone outside of the conventional realm that they were told would help them, they've already been through the gambit of hopelessness and being told something and it not working. And so then you have to unravel all of that too. There's a lack of trust with
Lack
all
of
doctors, let's say, then.
medical PTSD is the word that's used, and it's
Yes.
rampant. And I don't blame people. I mean, the amount of nonsense that gets thrown around in terms of diagnosis and treatment,
Right.
is quite extraordinary sometimes.